How is the heart formed in utero? Well, if you look up images on Google in regards to embryology of the heart, it's basically two separate tubes which join together, then start to convolute and turn and form chambers afterwards. Why do patients get arrhythmias? Most arrhythmias, as electrophysiologists, we know this, is at the site where two different muscles join. For example, between the atrium and the ventricle, where you have a pathway remaining. As a result, electricity is now flowing through it and causing a shortage, technically an electrical short. It causes arrhythmias, a reentrant arrhythmias, where electricity is rotating around. And what we do is we ask symptoms. If the patient has symptoms of palpitations, shortness of breath, has passed out, or syncope, we give the patient a monitor after an electrocardiogram. And if there's an obvious finding on the EKG, the 12-lead EKG, such as a delta wave or a WPW, and we know what's going on already, then from that EKG, we can actually know or localize whether it's coming from the right side or left side, or from the posterior portion of the heart or the anterior portion of the heart. When we bring the patient to the hospital and perform an electrophysiology study, we can actually already know where to go because we've already mapped it in our head from the electrocardiogram. We'll bring the catheter directly to that site. Let's say, for example, the left side of the heart and the lateral wall of the heart, which is the lateral aspect of the heart. We put the catheter there and we find the electrical signal that is connected between the atrium and the ventricle, and we'll look for Kent potentials. These are little potentials that are actually present during the conduction. And at that point, whether we have to pace or not pace the ventricle or the atrium in order to know where to burn, we'll ablate with the radiofrequency heating element or catheter, and immediately the arrhythmia subsides. Then we test and test over and over, including giving IV infusion of, let's say, medications such as isoprel or other medications if need be, in order to test to see if that conduction reconnected or not. There's a very high success rate, almost 100% success rate that arrhythmia is gone.